two serious threats to the humanity's health and well-being. Humans today live longer, healthier lives and suffer less disease than their predecessors at any previous time in history. For instance, a child born this year in a developed nation can expect to live for 80 years and more, which is nearly double the average of 40 to 50-year lifespan that was the norm only 100 years ago at the beginning of the 20th century. This unprecedented gain in health and longevity is a triumph for modern medicine and public health interventions. It reflects mainly the success of vaccines and antibiotics, the widespread availability of healthy food and safe drinking water, a 90% reduction in infant mortality due to more hygienic approaches to assisted labor and birth to pregnant mothers, and control of the ancient infectious diseases, cholera, smallpox, typhus, yellow fever, scarlet fever, tuberculosis, measles, malaria, pertussis, and polio, that previously decimated the world's population and mainly children. Nonetheless, there are two negative developments that overshadow this extraordinary progress and seriously threaten to undo it. First is the invention and wide dissemination into the modern environment of tens of thousands of new chemicals, new materials that never existed before in nature nor were found in the Earth's environment. These man-made, synthetic chemicals are used today in millions of consumer products. They have migrated to the most remote corners of the planet. Some are highly persistent and will remain in soil and water for decades, if not centuries, while other types of these chemicals may last in the ecosystem forever, such as Teflon, which is not biodegradable even after millennia. These chemicals get into people, including infants and children. For example, surveys conducted in several developed countries detect more than 200 synthetic chemicals in the bodies of nearly all their residents, even in the breast milk of nursing mothers and in the umbilical cord blood of newborn infants. The second negative development is the rise of non-communicable disease. Over the past 50 years, non-communicable diseases and disorders have become epidemic among the world's children. They have replaced the infectious diseases as major causes of disability and death. And they are on the rise. Here are some key statistics. Childhood asthma has nearly tripled in frequency since the early 1970s. Learning disabilities affect one child in 6. On average, one of every 68 children born in the developed world is now diagnosed with autism spectrum disorder. Leukemia and brain cancer, the two main types of pediatric cancer, have both increased in incidence by nearly 40% since the early 1970s worldwide. Despite tremendous advances in cancer treatment, cancer is now the leading cause of disease death among children. Certain birth defects have doubled in frequency, and birth defects have become the leading cause of death in infancy. Childhood obesity has more than tripled since the 1970s in the developed world. Today nearly 1 child in 5 in the advanced economies is obese. Type 2 diabetes, previously an adult disease, has become epidemic among children and is diagnosed at ever earlier ages. The epidemic of non-communicable disease in children began in North America, Western Europe, and other highly developed countries, but it is now spreading worldwide. Rising rates of asthma, cancer, birth defects, and obesity are seen today among children in India and China, as well as parts of Latin America and Africa that only a generation ago knew starvation and famine. The global pandemic of non-communicable disease in the world's children is one of the great health problems of our time. If it is not checked, it threatens to undo all of the great gains that medicine and public health measures have made in the past century. Toxic chemicals are important causes of non-communicable disease in children. Toxic chemicals in air, water, soil, household products, and breast milk expose children to health threats that can cause lifelong damage. Research in children's environmental health and epidemiology shows us that infants and children are exquisitely vulnerable to toxic chemicals. Exposures during pregnancy and in early childhood to even very low levels of lead, methylmercury, organophosphate pesticides, and polychlorinated biphenyls, PCBs, have all been proven to cause damage to children's developing brains that manifests itself by low IQ, shortened attention span, and disordered behavior. Moreover, early life exposure to air pollution causes asthma, pneumonia, impaired lung growth, and sudden infant death. Prenatal exposures to solvents and pesticides are linked to childhood cancer. Endocrine disruptors, such as phthalates and bisphenol A, are associated with birth defects, diminished reproductive function, and disordered behavior. It is always worth noting that toxic chemical exposures cause disease in children at exposure levels far lower than in adults because of their smaller body size and yet to mature metabolic and immune systems. Despite great recent gains in knowledge of the effects of toxic chemicals on children's health, there is an enormous amount we still do not know. For example, many of the chemicals in widest use today have never been tested for safety or toxicity. Fewer still have been assessed for their potential to disrupt early human development. Without safety testing data, there is no way to know whether a chemical may injure children or how it may do so. Although many of us rely on governmental regulations to protect us from the harms of chemicals, the reality is that in most developed countries the protections are shockingly inadequate and do not protect children against dangers of toxic chemicals. Most governments around the world have simply presumed that new chemicals are safe until they are conclusively proven to cause harm, and these countries have required little or no pre-market testing of most chemicals. In rapidly developing low- and middle-income countries where chemical pollution has become rampant, controls are almost non-existent, and children's exposures are severe. Consider, for example, urban air pollution in Beijing and New Delhi and arsenic contamination of drinking water in Bangladesh. As a consequence of the weak chemical control policies that exist today in most countries, people around the world and especially children are exposed on a daily basis to scores of chemicals of unknown hazard. The extent to which toxic chemicals in the environment are contributing to rising rates of autism, childhood cancer, birth defects, learning disabilities and decreased fertility is only beginning to be discerned. And perhaps even more disturbing, we are beginning only now, more than a century after the rise of the chemical manufacturing industry, to realize that exposures to toxic chemicals in early life may cause disease and disability not only in childhood, but across the entire lifespan. Early life exposures to toxic chemicals are now beginning to be linked to adult-onset hypertension, heart disease, stroke, and cancer, as well as to neurodegenerative diseases, such as Parkinson's disease and dementia. Copyright Academy House www.academy.house